Many people reach this point after learning they have fatty liver. They understand what it is. They understand why it often has no symptoms. They understand that alcohol is not always the cause. And then one question quietly takes over their mind. Can fatty liver become serious? Not someday in theory, but in real life, in their body. This question matters because fatty liver sits in a strange space between reassurance and fear. Doctors often say it is common. People around you say it is nothing to worry about. But online searches quickly mention words like inflammation, fibrosis, and cirrhosis. So let us slow this down and separate fear from facts. Fatty liver does not become dangerous overnight. And it does not become dangerous in the same way for everyone. The key is not the name of the condition. The key is what is happening inside the liver over time. Fatty liver by itself simply means excess fat stored inside liver cells. Fat alone does not destroy the liver. Fat alone does not cause liver failure. Fat alone does not automatically lead to cirrhosis. The liver can tolerate fat for a long time. In fact, many people live for decades with fatty liver and never develop serious liver damage. So why do some people progress while others do not? The answer lies in what happens after fat accumulates. There is a critical difference between a liver that is storing fat and a liver that is being injured by that fat. When fat stays relatively quiet inside liver cells, the liver adapts. It continues doing its job. Blood tests may look mostly normal, symptoms may remain absent. But in some cases, fat begins to interfere with how liver cells function. This is when inflammation can appear. Inflammation is not the same as pain. It is not something you feel directly. It is a biological response. When liver cells are stressed for long periods, the immune system becomes involved. Signals are released, inflammatory cells arrive, and the environment inside the liver slowly changes. This stage is often called fatty liver with inflammation. This is the point where risk starts to rise. Not sharply, not suddenly, but gradually. Inflammation is important because it tells us that the liver is no longer just storing fat. It is reacting to injury. And when inflammation continues over years, the liver begins to adapt in a different way. It starts to form scar tissue. Scar tissue is the body's way of stabilizing damage. It is a repair mechanism. But unlike normal liver tissue, scar tissue does not perform liver functions. As scar tissue increases, flexibility decreases. Blood flow through the liver becomes less efficient, and the liver's ability to recover slows down. This process is called fibrosis. Fibrosis does not happen quickly. It is measured in years, sometimes decades. Most people with fatty liver never reach advanced fibrosis. But for those who do, the risk profile changes. When fibrosis becomes extensive, it can eventually lead to cirrhosis. Cirrhosis means the liver's structure has been significantly altered. At this stage, complications become possible. But it is important to understand something very clearly. Fatty liver does not automatically progress through these stages. There is no fixed timeline. There is no guarantee of progression. Many people stop at the fat stage. Some develop mild inflammation and never progress further. Only a smaller portion move toward advanced scarring. So what determines the difference? It is not one single factor. Progression is influenced by the overall metabolic environment of the body. The liver does not exist in isolation. It responds to signals from blood sugar regulation, from insulin levels, from inflammation throughout the body, from how nutrients are processed day after day. This is why fatty liver is often connected to insulin resistance. When insulin resistance is present, the liver receives mixed signals. Fat storage increases, fat breakdown becomes inefficient, inflammatory signals rise. Over time, this combination increases stress inside liver cells. But again, this does not mean immediate danger. It means the liver is under chronic pressure. Chronic pressure, not acute damage, is what drives progression. Another important factor is time. Fatty liver that has been present for many years has more opportunity to evolve than fatty liver that appeared recently. Time allows patterns to repeat. Repeated stress, repeated inflammation, repeated repair. This repetition is what gradually reshapes liver tissue. Age also plays a role, not because aging itself damages the liver, but because recovery becomes slower. The liver is remarkably resilient, but it is not infinite. As recovery capacity declines, unresolved stress accumulates more easily. This is why two people with similar test results today may have very different futures. One liver adapts and stabilizes. The other continues down a path of gradual injury. So when does fatty liver become dangerous? Not at diagnosis, not when fat is first discovered, and not simply because fat is present. It becomes dangerous when inflammation and scarring quietly progress without being recognized. And that progression is usually silent. Most people do not feel their liver becoming inflamed. They do not feel fibrosis forming. They do not feel early cirrhosis. This silence is what makes understanding the process so important. Danger does not come from sudden collapse. It comes from long periods of unnoticed stress. The good news is that progression is not inevitable. The liver responds strongly to changes in its environment. When metabolic pressure decreases, inflammation can calm. When stress signals reduce, recovery becomes possible. This does not mean reversing everything overnight. It means slowing the process, stabilizing it, and in many cases preventing it from reaching dangerous stages. That is why fatty liver is best understood as a spectrum, not a switch. At one end, there is simple fat storage, with little consequence. At the other end, there is advanced scarring. Most people remain closer to the beginning of that spectrum. Fear comes from imagining the worst case as the default. Reality is far more nuanced. Understanding where risk actually comes from allows people to focus on the right questions. Not, do I have fatty liver, but what signals is my liver responding to over time? In the next video, we will take this understanding one step further. We will look at why blood tests and imaging sometimes fail to reflect real liver stress, and why many people are told their liver is fine, even when deeper changes are beginning. Because understanding risk is not about labels. It is about recognizing patterns early, before silence turns into damage.